Hi, welcome to Talk 1260 KTRC. You are listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm here with my wife, Betsy Ronel. I'm a plastic surgeon, and we're going to talk about a lot of things today. We've got a tip coming up on melanoma, and we're going to talk about Julie Roberts.
Yes, she made a grand statement in the news, and it was on The View during this week, about that she's, I think, what is she, like, right around 40, and she wants to grow old, not for using a common phrase, gracefully. I hate that expression, grow old gracefully. Yeah. She wants to honor her body as it ages. So she said, at least for now, she's not interested in getting any kind of plastic surgery, injections, Botox, any kind of little nip or tuck at all. She just wants to honor her body and honor her age.
Well, I think that's great. She
happens to look very good.
She has the capability of doing that, and she will age with the same beauty that she has now. But I don't quite understand what's not graceful about Botox or filler or facelift.
You and Joy Behar feel the same way. Joy Behar was like, what? You know, she quacked up, and because she gets it. She admits that she gets it a little bit.
I mean, there are people who don't want to go very far, for example, so they won't get a facelift because they seem to think that that is really a big change and very invasive, and perhaps they feel guilty about the cost. There are lots of reasons for that, and that's true. You respect them, but they still can come in for smaller things like Botox or a filler or something else.
Right.
But you know, if you buy a really nice skincare product, La Mer, or beautiful soap,
what are the ones that we have?
Or
what's that? You have an awesome one now. Neocutis. I've been using it.
One. But if you go to a department store, or if you go on a trip and you're in New York, and you go to Sephora and you buy something beautiful for your skin or your hair, it can cost as much as an aesthetic treatment.
Okay, an aesthetic, it ain't going to cost as much as surgery.
No, it's
but
not.
maybe some Botox,
but it's
La Mer.
Yeah, but if you just extrapolate why you're doing that is to make you feel better, you'll look a little better to make you feel better, it's really not that much of a reach to go on to something like a filler.
It is, because that's invasive. Listen, I can argue in the face of this because my face is juiced to the hilt, and I have no shame about getting cut open and tightened up. I will do that as needed. Right. But and I love it. But I'm just saying, I get the people who aren't interested in that. Right. I get it, because a topical treatment is far different from an invasive thing like an injection, an incision, obviously. That's invasive, and it's true alteration. Whereas, a skincare product is just daily maintenance.
Okay, fine.
It's gentle care.
Okay, fine. Today I did a facelift on a 47-year-old, and she's young. She's not much older than Julie Roberts. She's going to sail into her 60s, looking terrific.
That's her choice.
And that's her choice. I think somebody like Julie Roberts has had her choice made for her by God and her genes, because she looks very good. It
also just depends what you want. Then these ladies on The View, because that's who announced it, went on to talk about, the people whose faces don't move. Like, there's that famous dermatologist, Frederick Brandt, who has sort of taken over the filler and Botox world, even though he's not a plastic surgeon. He is very bright and obviously knows what he's doing, because he's very accomplished in his own skincare line. He is one of the lucky ones who is smart and has embraced it and really knows how to work those needles.
Right.
But his own face doesn't move. He's so, and I don't mean this in a bad way at all, he'll tell you this too.
It's his choice.
Yeah, he's so juiced up with filler in every square cubic inch or whatever the measurement is of skin, there is one, with filler and Botox. He looks so strange. His neck too. Yeah. He looks so odd.
No, I had a guy today.
That would scare me from him, because I'd be like, oh, you're very drastic. I don't want you doing that to me.
Right. You don't see a lot of that in Santa Fe.
No, God.
I was saying, I had a guy, a builder today in my office who had Botox in his central forehead, and for a male, that's really the part that you want to smooth out if you want to do that. And he was asking about, well, what about the deep lines over laterally, and that really looks unusual, at least on a male. And in any case, it's not a great idea to put Botox way there because it can cause the brow to droop.
What, on the outer edge of your eyebrow? You need to explain this.
Right,
okay.
on the outer edge of the eyebrow.
Okay.
So,
yeah, no, with men it's different.
Yeah.
I mean, unless you're a very flamboyant person and you want to look a certain way, that's one thing.
There's also an interesting article, a study that came out. It's not a good study, so I don't really support its findings, but it gives me food for thought. Is people who've had Botox, who therefore don't make as many expressions on their face, can be very confusing in conversations with someone else.
This was in the general media as well. There have been articles recently written about this.
Right, so there may be a psychological effect where if somebody's speaking to somebody who's had Botox, they don't really communicate well because they're not reading the visual cues, you know, of their brow and their eyes when they speak.
I mean, you know, if perhaps a psychiatrist should have that. You know, they're not allowed to have a reaction. Or someone in human resources who fires people all the time, maybe they should, you know, have a poker face. Or someone who plays poker professionally, let them have a poker face. But anyway, I thought it was interesting, just because we have to wrap this up soon. Julia Roberts, one of the biggest movie stars in the world, is choosing currently not to do anything. She didn't say currently, that's my addition. She said she's not going to alter her looks in any way, shape, or form. She's just going to grow old with respect to her aging process. She's going to look great. I mean, I don't think Meryl Streep has had much done. She's probably had a little something here and there, but
it's hard to know.
It's hard to know because there are just some people. There's
a great picture of her, Meryl Streep, with her hands on her face, sitting there, and she's pulling her skin back.
Of course.
You know, which is that's the natural way to do it.
But Meryl Streep strikes me as someone also who would probably not want to alter herself in a serious way. But it's just interesting because, but what I don't like is people who say, "Oh, I'm not touching that stuff." Like it's some kind of poison or some kind of awful thing.
I get a lot of people who say that Botox is a poison. How can you do that?
I mean, technically it is. It's very different the way you're using it.
So is aspirin, so is willow, so is foxglove. So there's a lot of different
So I mean, that's one very drastic and inaccurate, with all due respect, Ms. Roberts, way of looking at it. I don't know that's the way she looks at it, but to say, she didn't say this, but for people who say, "Oh, I would never do that. What's wrong with growing old and just, you know, honoring yourself?" That's fine, but it should not be because the other stuff is bad, because it's not bad. However one chooses to approach life physically, whether they work out, whether they don't, whether they get plastic surgery, whether they don't, whether they get a little or whether they get a lot, it's all personal. So Julia Roberts doesn't want to touch herself? Great. She can do it.
Okay, we've got to wrap it up.
Okay, I'm not done. And, you know, people who want to get all juiced up, Joan Rivers, great. That makes her happy for whatever the reason is, go for it. That's it. Whatever you want. Do it well, and be happy with your choice.
Okay, thank you.
That's my words of wisdom.
Okay, you've been listening to Talk 60 KTRC. We're going to take a break, and then we're going to listen to a skin tip, and then we'll be back. Thank you.